Welcome to The Explainer. Today, we're going to break down one of the most common cancers in the world, prostate cancer. We're going to get into why catching it early is so incredibly important and what modern medicine can actually do about it. Okay, so let's just dive right in. The real challenge with prostate cancer, the thing that makes it so tricky, is that it basically has two completely different personalities. You see, on one hand, you have cancers that are really slow growing. They pretty much stay put and don't cause much trouble. But on the other hand, you've got these aggressive types that can spread fast and need attention right away. And that split, that's exactly why we need to talk about this. And we really need to talk about it because this is an incredibly common cancer. So confronting this complexity, this tale of two cancers, is truly our best strategy. And it all starts with a single, simple goal.
And this quote from Dr. Carlos Vargas at the Mayo Clinic just hits the nail on the head. The whole point is to catch it early, when it's still contained. That's when doctors and you have the most options and, frankly, the best odds. Which brings us to the most powerful tool we have in our arsenal, screening.
So let's talk about what that actually looks like, because screening is what builds that path to being proactive with your health. This isn't about waiting around for symptoms to show up. It's all about getting way out ahead of the problem. And, you know, what's kind of amazing is just how straightforward that first step can be. The main tool for screening is something called a PSA test. And it's not some big, complicated procedure. It's just a simple blood test that looks for a specific protein. Now, a high level doesn't automatically mean you have cancer, not at all. But it is a critical red flag that means it's time to have a conversation. And that's really what it all boils down to. This simple three-step loop. It starts with just talking to your doctor about your personal risk. Then you get the blood test. And finally, you have another discussion about what those results mean specifically for you. It's an empowering cycle, you know? It puts information in your hands. Okay, so that's the process, but who exactly should be having that conversation? Let's break down the factors that can actually bump up a person's risk. So your personal risk profile is really based on a handful of key things. First and foremost is age. It's just way more common in men over 50. Family history is also a huge one. If a close relative like a father or brother had it, your risk goes up. Same thing if you have a family history of certain gene mutations, like the BRCA genes you might have heard about. And last, but definitely not least, is rape. And this statistic from the CDC, well, it's pretty sobering, and it's something we absolutely have to talk about. In the United States, Black men are not only more likely to get prostate cancer, but they're more than twice as likely to die from it. That's a stark reality, and it just underscores why early, regular screening and those informed conversations with doctors are so critical for Black men. Now, let's say screening does find something. It's totally natural for your mind to jump to the worst-case scenario. But what happens next? Well, it might not be what you think. A diagnosis doesn't always mean you're rushed into aggressive treatment. And this right here might be one of the single most important things to take away from all of this today. For a lot of those slow-growing, early-stage cancers, the best move isn't to immediately intervene. This is a massive shift in how we think about a cancer diagnosis. So after an early detection, you often find yourself at a fork in the road. For many, the path forward is actually careful observation. It's a strategy called active surveillance, which basically means regular checkups and tests to keep a close eye on things. This avoids the side effects of treatment for a cancer that might never be a real threat. Active treatment, on the other hand, is saved for the cancers that are more aggressive. And as Dr. Vargas explains so clearly here, watching it is a perfectly safe and common approach. But, and this is the crucial part, listen to the end of his sentence, the problem is when you are not screened. This choice, this fork in the road, only exists if you find the cancer early. Without screening, you lose the chance to even choose this path. But what if you do need active treatment? What if you're on that other path? Well, the good news is the options available today are just miles ahead of where they used to be, offering more precision and better outcomes than ever before. I mean, just look at this. Today's medical toolkit is incredibly diverse. We are not talking about a one-size-fits-all approach anymore. From unbelievably precise robotic surgery to targeted radiation to hormone therapy, the treatment can be tailored to the person, the cancer, and their overall health. And this really shows you how much progress has been made. Modern radiation, for example, can be delivered with pinpoint accuracy. Think of it like a smart bomb that only hits the cancer cells, leaving the healthy tissue around it alone. And that kind of precision is a total game changer, not just for localized cancer, but even in some cases where it started to spread. It's helping to extend lives and control the disease in ways we just couldn't before. So when you boil it all down, what's the big takeaway here? It's that knowledge is your first and, frankly, your best tool. From understanding that this disease has two very different faces, to knowing your own personal risk, to seeing the power of screening. Being informed puts you in control. The options are better than they've ever been, but every single one of them begins with the exact same thing: a conversation.